Sir Surendran?
Okay, go ahead, sir. Please.
1 second, I'll just take it. You sent it here. Yeah, so it's a pleasure to introduce Dr. Surendran because I worked with him, and his brother and my brother are classmates. So we have visited when I was in 6th standard only to his house. He's a MBBS DO from Madras Medical College and MPhil and FRCS Edinburgh. His current position is Vice Chairman and Director of Pediatric Ophthalmology, Director Orbis International Reach Project, Trustee and Board Member of Shankarnetralaya Chennai, and Shankardev Netralaya Guwahati, Assam, Chairman Institutional Committee for Stem Cell Research, Common Stanley Hospital, Chennai, and Board Member Chennai Breast Cancer Research Foundation. And he has been President of Subspecialties Society and Pediatric Ophthalmic Society of India for 6 years, has had training with Dr. Marshall Parks and Alan Scott, USA, has 40 years of experience with ophthalmology, mainly pediatric, Botox, contact lens, and low vision aid, and taught students of postgraduates in ophthalmology and optometry, including me. And awards is a Lieutenant Colonel Rangachari Gold Medal from All India Ophthalmic Society, for the same award from Rotary Club, Dr. Joseph Yanaka Award from TNOA, Best Doctor Award from Dr. MGR Medical University, Lifetime Achievement Award from Subspecialties Society, Dr. Badrinath Gold Medal from TNOA, Lifetime Achievement Award from Vista India, Lifetime Achievement Award from TNOA Ponde, Lifetime Achievement from Lions Club, 55 national conferences, 73 lectures, 13 instruction courses, membership in several international organizations, conducted skin camp. And according to me, I know he's the only ophthalmologist who's not doing cataract apart from me. And he's the only ophthalmologist doing squint surgery. And I think he always tells that he can close his eyes and do the squint surgery, the fastest in the world. And I think I'm a witness to it. And apart from all that, he's a great human being and a great man who always could joke with Dr. Badrinath when everything was going helter-skelter in Madras. When I think whenever we come out of Dr. Badrinath's room, and he is there always to not only console, joke, and make us comfortable. And I think I know him from probably 1970s. So here we have Dr. Surendran.
Thank you very much, sir. Surendran, sir.
We all nicely call him TSS. And can you start with a joke, sir? I know it's a very serious award session, but I think we are happy to have you're always witty, and that's what we like about you, apart from your astounding knowledge you have in pediatric ophthalmology.
I'm a changed man, no jokes, and thanks for the introduction. I am deeply indebted to my fellow professionals and the All India Ophthalmic Society for the honor and opportunity to deliver the second L P Agarwal Endowment lecture for this year, 2021. This privilege and honor was bestowed upon Dr. Gulapalli Rao, who just in time physically delivered this lecture in February 2020. We now must content ourselves with the virtual mode, given the uncertainties that we are facing. Thanks to the modern day technologies of virtual meetings that enable us to seamlessly connect all, I believe that it is in this time of crisis that we are pushed to our limits, and we discover hitherto untested abilities emerging to bring solutions to the different problems of the community. I have seen the power of strong challenges that changing scenarios bring about in our own profession, ophthalmology, that push us to quickly adapt to newer methods and procedures. The topic for Dr. L P Agarwal this year is Science of Ophthalmology and My Philosophy. And this was a little unique to me when Dr. Partha Biswas spoke to me and told this topic. I'm honored that AIOS has given me this opportunity to reflect on my philosophy in the realm of science of ophthalmology. At the outset, my philosophy, I must admit, is slightly colored. I mean, I spent my entire professional life as a surgeon in a world-class non-profit organization. Yes, for more than 40 years. I'll come to that later. Dr. L P Agarwal, in whose memory this endowment lecture series are instituted by AIOS, was an enthusiastic teacher and a meticulous clinician. Professor L P Agarwal was a visionary who planned to the first blindness control program to be started in India, and also as the founder chief of RP Center All India Institute of Medical Science. He was the Dean of All India Institute, New Delhi from 77 to 1979, and thereafter Director of AIMS from 79 to 84. I was fortunate to be his student to attend some lectures, and it is indeed a great honor to deliver this lecture in his fond memory. I am once again thankful to the AIOS for this great honor. I have 15 minutes to deliver this lecture, but I'll stick to the timelines. I must mention here that the prestigious endowment lecture, the name of the eminent doctor and teacher, 15 minutes is a too short time. As a gesture to the next speaker next year, I humbly request the AIOS to enhance the time suitably. But today I'll try and compress my thoughts within the prescribed time. At the outset, I must mention that this lecture is not a high-end technical presentation to an already highly experienced, competent, and talented group of fellow professionals who have been serving the community very well. I wish to dwell upon in this short time, certain important aspects of our profession, which I strongly believe in, so that the aspiring students and the future generation of ophthalmologists can arise and awake and stop not till the goal is reached, as per Swami Vivekananda, whom I follow. First, about the science of ophthalmology. The existence of eyes is so fundamental to our profession that we often do not pay any attention to its evolution. I do not wish to go back to the classroom lecture, but it is important to absorb and respect the contribution by stalwarts of yesteryears to whom we owe a lot. Sight is an evolutionary gift. The science behind eyes has evolved over the past many million years along with the science of medicine. Ophthalmology is only a branch of medical sciences handling both medical and surgical solutions of the disease of the human eye. That's why I've chosen ophthalmology. The eye has been the subject of conflicting interpretations since ancient times. The oldest evidence of surgical practice by Sushruta, almost 2 million ago, opened the windows of professional surgical practice. Only a practicing surgeon could have given such detailed description and surgical techniques. Sushruta Shashmita was elaborately described couching, a technique to manage the cataracts. This Samhita also has excerpts on code of ethics for teachers and students, implying the significance of Guru Shishya Paramapara and how important it is that a healthcare professional imparts education and passes his knowledge and skills to the students through vigorous training. I am deeply fascinated by this code as it resonates with my philosophy of lifelong learning and imparting learning. Yes, we have come a long way from there, but it is impossible to deny that some of us in the older generation of doctors sometimes wake up to the reality of the complexity of the human anatomy and unconditionally salute the creator. Then came Kepler. He was a German astronomer, mathematician, and astrologer. And in that era of 17th century, there was no clear distinction between astronomy and astrology. He changed the whole picture. We all know about the contributions he made as an astronomer to the science of ophthalmology. Many of us know how in recent years the Keplerian telescope has assumed a practical significance of ophthalmological optics. It offers a significantly higher magnification than any other optical visual aid for individuals with impaired vision. In this era, new theories of sight place greater emphasis on the fusion of anatomy and geometry in studying the eye. Kepler created the idea of the retinal image as an image that had been reversed and then restored through the process of reflection and refraction, like how the lens in Kepler's telescope, which showed the heavens upside down. Why I request you to call this, because we need to appreciate that the science of ophthalmology has gone through a rigorous, tedious, and long journey, which has today produced so many specialties dealing with the diseases of the eye. The core picture of most ophthalmologists deal with the health conditions that affect the eye, which today has so many specialties. If I outline the list of subspecialties, it could be a sizable amount of my time, but each one of those in the fields understand our limitations, and respectfully do not stay into areas where we are unfamiliar. Such is the level of acute specialization. When it comes to the world of ophthalmological instruments and gadgets, there are numerous state-of-the-art equipment that enhance the ability of the doctor. Take, for example, the retinal camera, the photocoagulator, the photocoagulating laser, the corneal cell counter, wavefront aberrometer, and not to forget the handheld keratometer, for which I got the Colonel Rangachari Award. Another major help in the digitized patient records and workflows. They have significantly boosted the capabilities of doctors in enhancing diagnostic skills and appropriate and timely treatment protocols. I commend organizations like Orbis that partnered with institutions to combat blindness through the Flying Eye Hospital and other models of enabling technologies, more so in the pediatric specialty. Community ophthalmology, the state-of-the-art mobile eye surgical unit, such as the MISU van, wherein we can operate, which is the initiative of Shankar Nethralaya and is the only institution to operate in the bus. And tele-video consultations, tele-ophthalmology have all taken modern eye care to far-flung areas, tribal areas where poor patients have no means to come to the base hospitals. It's important for us ophthalmologists to do some blue sky thinking and blue sky research too. While it is important to continue our daily professional pursuits, we have a responsibility to direct young minds to the field of research that changes lives. Technology is now advanced. We can now integrate the gene and comprehend how gene influences the cell behavior and understanding by imaging tissues at very high resolutions. The eye is a window, and through that we can see through to a single cell level to understand its function. We are now moving to areas of personalized therapy. Before I shift my focus to my own philosophy, I think it is important that I touch upon the evolving science of vision. The science of ophthalmology and the science of vision are distinct, but deal with scientific study of vision, and its convergence is now driving investigative ophthalmology. Vision science also encompasses non-human organisms that process visual information, visual perception, and its ramification in the communication and artificial intelligence systems. A few of the mark eye institutions in India have significantly contributed to research in the field of eye diseases, but these are grossly inadequate. I believe that we need national organization like RO, driven by the joint efforts on a few of the mark eye institutions in the country. RO is the largest and most respected eye and vision research organization in the world, based out in Maryland, USA. RO advances research worldwide in understanding the visual system and preventing, treating, and curing the disorders. We need to inculcate a culture of research starting from our medical school onwards, so that select talents can pursue serious work under the guidance of competent scientists and ophthalmologists. The compensation for these talents should be sufficiently attractive to prevent them from taking up the regular jobs. Unless we take conscious steps in this direction, serious research will suffer. We have a duty to give back to the scientific world from which we have taken so much for our own benefits and for the benefit of the patient community. Ophthalmologists in general have shown the grit and enterprise to establish successful practices. So why not collaborate for research? Now about my own philosophy in the realm of the profession. I had mentioned earlier that my philosophy, the matter of bit colored, it's largely influenced by the eminent and strong personalities that I was fortunate to spend my time with more than 4 decades. Such people not only sharpened your skills, but also significantly influence your thinking and your very character. I fondly recollect my own mentor, Dr. S.S. Badrinath, with whom I continue to work even at this old age. Then Dr. G. Venkataswamy, Dr. Gulapalli Rao, Dr. L P Agarwal, Dr. Namparma Swami, to name a few, who have all made significant contributions to the science of ophthalmology. When you work with such great stalwarts, you become like a well-seasoned pickle kept in the brine for ages with distinct color, shape, texture, aroma, and taste. I hasten to add that such objects to be pickled or hand-picked by the chefs themselves. Let me caution you here, the word pickled is also a tricky word in the English language. It has completely disastrous meaning when used in different contexts. You can check it out. But I meant it in the manner I have described and nothing more. I'm happy that I went through the grill as I reflect on the variegated experience I have gained as a professional surgeon, as well as a compassionate human being. My alma mater, Shankar Netralaya, the temple of the eye, is where I would like to begin as I travel through time in the convergence of cutting-edge science of ophthalmology and uncompromising compassion. The passion for both professional excellence and a deep sense of compassion is the hallmark and DNA of institutions like Shankar Netralaya. Shankar Netralaya is even today recognized for its significant contribution to the creation of knowledge with a sincere and serious focus on education, training, and research, and training more than 1,000 fellows in ophthalmology in the field of eye care. Its goal is to address the nation's goal for defect-free vision for all, and I strongly believe that medicine and compassion go hand in hand. Apart from professional competence and skill, which is given a medical professional, whatever be his branch of specialization, should have the following attributes also. The first virtue is generosity, the ability to be kind. The second virtue is pure ethics, the cleanliness of thought and action. The third is tolerance, the capacity for fairness. The fourth is perseverance, the willingness to be diligent. The final and crucial one, very important, is accountability, the willingness to accept responsibility. These virtues will empower the caregiver with a human heart. These virtues are indeed the core pillars of my philosophy. These, fortified by my skills always, will work for the benefit of the patient who trust me implicitly. I also strongly believe that a serious medical practitioner should keep himself up to date, teach and aid in the research projects. And I conclude this lecture with dwelling my philosophy. I must draw the attention of all my fellow ophthalmologists to the grave situation in the country and the slower growth, shrinking middle class. The woods are lovely, dark and deep, but I have promises to keep and miles to go before I sleep and miles to go before I sleep. Thank you for listening to my patiently. I may have exceeded my 15 minutes quota by a few minutes. I want to once again thank AIOS for giving me